We make jokes about being a little ADD, but if you actually have attention deficit hyperactivity disorder or know or live with someone who does, it isn't always very funny. Experts discuss symptoms and treatment of attention deficit hyperactivity disorder at any age. Tonight on Speak Your Mind. Welcome to Speak Your Mind. I'm Dr. Carolyn Phelps, licensed psychologist with the Human Development Center. And tonight we're taking your questions on attention deficit hyperactivity disorder, ADHD, in kids and adults. And as always, we depend on questions from you, the viewer, to help us explore this issue. You did a bang-up job last week, but that still doesn't get you off the hook for this week. So call the numbers on your screen right now. Locally, dial 218-788-2844 or call toll-free at 1-877-307-8762. And you can also text us your questions or email them using the number or address listed at the bottom of your screen. We're going to start, as always, by introducing our guests. Dr. Charles Orsak is a licensed clinical psychologist with Essentia Health who specializes in the assessment and treatment of children and adolescents with developmental, cognitive, and anxiety disorders. And Dr. Margaret Saraceno is a staff psychiatrist with the Human Development Center who's board certified in child, adolescent, and adult psychiatry. Thanks to both of you for being here this evening.
Thanks for having us.
And we always start with getting everybody on the same page. So, Charlie, I think you'll get us started by talking about the symptoms of ADHD.
Well, first let's talk about the core symptoms are inattention, hyperactivity, and impulsivity. But the first thing to realize is that those can be symptoms of many different things. Anxiety causes inattention, depression causes inattention, stress causes inattention. So we need to be aware of the fact that that's a general symptom. But in terms of ADHD itself, I mean, the term attention deficit hyperactivity disorder, there's two groups of symptoms. There's the inattentive symptoms, which have to do with distractibility and inability to sustain focus, those kinds of things. And then the hyperactivity and impulsivity is excessive levels of activity and energy and impulsive, thoughtless behavior. So those are the two major groups of symptoms.
And so a lot of times, Dr. Saraceno, I know I have people coming into my practice, and I'm sure you have people coming into your practice who are wondering if they are ADHD just because of the inattention that they're experiencing. But one of the things we have to tease out then would be what other kinds of problems might this be a part of? Is it attention deficit disorder or is it something else?
Are you referring to adults or children or both?
Both. Let's talk about both. Let's talk about adults for a second here.
Okay, for adults. Well, it's not uncommon for people to come in with problems with attention or concentration with the concern about possible inattentive ADHD, but you really need to look at the whole person, look at anything medically that could be going wrong with them, a thyroid disease or other systemic problem, medical problem that could be causing some problems with attention and focusing. And we also really need to look at comorbid medical diagnoses, such as depression can cause poor attention, poor concentration, poor motivation, and other associated symptoms. Anxiety, chemical dependency, we have to screen for alcohol use and drug use. So it's really to make a good diagnosis, getting a good clinical history, getting a good medical history, find out what medications they're on, because there are some medications to treat medical disorders that can cause symptoms of inattention and poor concentration. So it really takes a good comprehensive medical and psychiatric history.
Let's talk a little bit more about the symptom of inattention and how would the symptom of inattention, if you're a parent of a child, what might you be noticing in an ADHD child in terms of the inattention aspect?
Well, attention has many facets. So it runs everything from being able to sustain your attention over time. And kids with inattentive ADHD tend to have the most trouble sustaining attention in situations that they find boring or they aren't inherently interesting. But then there's focused attention, kind of the ability to focus on the thing you need to focus on. And then there's flexibility of attention, meaning that if I'm supposed to be paying attention to this part of the classroom now, but now I need to shift over, I'm able to do that when I need to. So it has those different facets. But kids the teachers will describe the kids as being off task, daydreaming, short-term memory problems. So you get various kinds of descriptions.
And maybe not being able to follow instructions, is that
right?
Is that
follow instructions. One component as kids get older, the idea of what we call executive function, or that ability to self-control and direct your behavior, becomes more and more prominent. So things like planning and organizing and time management, and being able to initiate behavior, monitor your own behavior, motivation for doing things. Those are all facets of attention.
And so that's how it might manifest itself in childhood. But I also hear about let's talk a little bit about the hyperfocus that you get sometimes with ADHD in kids. Dr. Saraceno.
The hyperfocus?
Yep.
What I think about with hyperfocus with kids with ADHD is video games. I mean, there are some activities that if they're interested in, some parents come in and they say, well, they do poorly at school, but he can sit for hours in front of the TV or the video game, and I don't know if that means that he has ADHD. And actually, like Charlie said, if it's something that they're interested in, that's stimulating, that's kind of getting their mind going in a fun way, they can stay for an extended period of time doing that. That doesn't mean that they don't have ADHD.
And I think sometimes even when kids have been diagnosed with ADHD, and parents are maybe in that phase where they're working through that phase of accepting the diagnosis, and they hear that they're not doing well in school, but on the other hand, they're watching them focus like crazy at home on television or on a video game. It can seem more of a willful, maybe they're not just trying hard enough at school. And what would you say?
One of the differential diagnoses, the way that I approach it is, kids have problems, that things they won't do and things they can't do. So a child with ADHD can't sustain their focus because of the way their brain works. Now, admittedly, there are kids who just don't want to, and so that's part of an evaluation, is to find out if this is behavioral, because sometimes it is.
And I have one thing to add to that. That how I might say to a parent, if you put a law book in front of me, I'm going to be looking out the window. I'm going to be thinking of my cub list. I'm going to be doing a lot of other things because I don't understand what those words say. And I'm not going to have the attention to read that because I don't get it. And so another thing we need to look at is, could there be a learning disability or something else going on with a child that makes attending and concentrating at school difficult?
And what are we going to see that's maybe how is this inattention then? Let's talk a little bit about how the inattention manifests itself in an adult with attention deficit disorder.
Well, back to the idea of one of the things that you need to learn to do to pay attention is to be able to pay attention to something long enough to accomplish your goal. And so that involves this idea of being able to initiate your behavior, organize it, plan it, self-monitor it. And so in adults, it mostly manifests itself as disorganization, inattentiveness, inability to follow through, and this sense of being foggy-brained. And it'll show up at work more than it'll show up anywhere else.
Although a lot of spouses, though, too, will complain about, I asked you to do this task for me, and then you never seem to do this task for me, or you're always losing your keys, and you can't keep track of those kinds of things.
So I must have ADHD.
I've been meaning to talk to you about that, Dr. Orsak, for years, and that's why I invited you on the show tonight. So we have a question here. Dr. Saraceno, from somebody in Duluth: do artificial sweeteners and artificial dyes affect or cause ADHD?
I am not aware of any scientific evidence that shows that those can cause ADHD. And if Dr. Orsak knows something differently, please chime in. But what I say to parents is, if you find, or an adult, if you find something that you ingest and you find that you have a harder time concentrating, or if your child eats something and you notice that they're behavior is more activated afterwards, then, you know, do what you can with what you have and what you notice. Just because there's no scientific evidence doesn't mean that that doesn't matter to your child. So you do what you can with what you have, but there's no scientific evidence that says, well, we can't use this and we can't use this and we have to feed them this or this, otherwise, you know, they'll get symptoms of ADHD. I don't know any hard evidence. There might be some suggestions in some studies, but I haven't seen any one-to-one cause effect.
Well, what I'd say is that when psychologists and psychiatrists, we talk about ADHD, we're talking about a specific, what we term neurobehavioral disorder, which is a brain-based, probably mostly genetically based condition. But as I said before, many things can cause inattention. So a good place to always start is start with your child's pediatrician or your primary care provider or advanced practice nurse and go in and do a full health evaluation. Because there's nothing to say that say a child did have something like celiac disease or something like that, that inattention could be a secondary manifestation.
Absolutely.
And so it's not to say that there aren't kids out there that have a dietary reaction to something, that inattention is a secondary feature. But the way that I define ADHD as a medical term, they wouldn't fit in that group. But I would always start with a good medical exam.
And a hearing test.
And a hearing right.
And a lead level. You know, some of the other medical screens that can cause.
And I think these are really important points that you're bringing up, because I think sometimes we forget, you know, it is that old mind-body interaction, and that we need to verify first that there's not something medically going on that could very simply account for what we're seeing in our children then. But that's not to say, I'm sorry, but that's not to say that if you feed your child junk food and soda and, you know, they're not going to be healthy children, they're not going to be able to sustain attention if they're not getting proper nutrition and proper rest. I mean, there's that component to, you know, a child's functioning too. Absolutely. Let's talk about the hyperactivity aspect of ADHD. What's a parent likely to see, and mostly, how do you distinguish hyperactive 5-year-old from 5-year-old?
Yeah, from your regular 5-year-old. A couple of things. Number one, if you get a room full of ADHD kids together, one of the things you'll be struck with is how different they all are. So not all ADHD kids are alike. I mean, they have certain things in common, but they all have their unique personalities, and they have a lot of strengths too. But if you're taking some young children, and you're looking at the issue of hyperactivity, one of the things we want to make sure we don't do is mistake healthy level of activity for hyperactivity. The best way to measure that is to have parents and teachers or anybody else who knows the child well fill out behavior rating scales that allow us then to sort of compare boys to boys and girls to girls, because it's different, and to say, what level of activity does this 5-year-old boy show? So if they're more active than 80% of boys, that's just active. If they're more active than 95 or 98% of boys, then we're in that hyperactive range. So the best way to assess hyperactivity is to talk to people who know the child well, and then to go the next step and try to measure that behavior.
Now, in my practice, and when I think of the adult clients who I see with attention deficit disorder, and I deliberately left out the H because I'm not seeing the hyperactivity component in them. Is the hyperactivity component really dropping out in adulthood then?
I think it shifts developmentally to more inner restlessness. You might, what I kind of am doing here, moving my leg up and down.
The show.
Yeah.
Nice job.
But more of a sense of inner restlessness, the disorganization, the difficulty finishing tasks, tapping the pencil maybe, but it's not so much hyperactivity. They can sit in their seat. They're not like leaving the classroom or leaving their workstation, but they might just be not focusing very well and feeling this restlessness.
Or a person who's just like fiddling with their hands and moving all of the time. And my experience, I know when I'm seeing somebody with that, I want to just take their hands and stop them because they seem so restless like that, and which is more than the average and more typical than what I see. Here's a question from somebody in Superior, Wisconsin. What are some of the challenges parents tend to come across with a child with ADHD?
Well, the challenge, one of the main challenges is school is very difficult for some of these kids. I think that I tell some parents that we could design a school for their child with ADHD, and the other parents would be complaining to me because things are moving too quick, you change subjects too fast, but sometimes it's just that mismatch between the child and the way a school operates. Because ADHD itself doesn't imply anything about how smart a kid is. I mean, those two things are totally independent. Mm-hmm. So one of the biggest challenges is keeping a positive attitude towards learning, because it is so hard for them. Because once a child who is struggling in school then starts hating school, then you have two problems. Then that really hits their motivation and their self-esteem. So that's one. Homework is another time when this becomes a big chore, because it usually takes longer. And if kids are taking medicine, the typical medicines aren't working anymore in the evening. Mm-hmm. They're kind of out of the kid's system. And so those kinds of things. Kids with ADHD do tend to also have some social problems. The same sort of behaviors, this sort of hyperactive, impulsive, sort of intrusive behavior, it hurts friendships too. So that can be a challenge.
And hard for a parent to watch, maybe then,
right.
as well, mm-hmm. right?
Mm-hmm. Right.
Here is Christina from Duluth, who asks, what kinds of treatment and other forms of therapy are available for adults with ADD with inattention? So let's talk about treatments then, Dr. Saraceno.
The medication
Let's
treatments?
talk medication.
Okay. After first doing a good assessment, medical, seeing what meds they're on, if they're on any medications, and really being clear that this indeed is ADHD, not some other disorder. If it's clear-cut, streamlined ADHD, the medication class of medications that have been most effective for ADHD are the stimulant medications. So Ritalin, Dexedrine, Adderall, Vyvanse, there's many out, Focalin, there's a number of them, some short-acting, some long-acting, but those 70% of people with ADHD, with or without the hyperactivity, respond to the stimulant medication. And those are, well, I don't know how much you want me to get into the stimulant medication, but they are very effective. They're quick acting. The wonderful thing about it for children specifically is you can take it Monday through Friday when they need it for school. They don't need to take it on holidays and summer vacations if their behavior is not that excessive that they need it on the weekends for family functioning. But so it's quick acting. You'll know if it works right away. But of course there's risks and benefits and side effect risks, and I bet you might want to know some of those.
I bet I might want to know some of those. I'm glad you asked, Dr. Saraceno. What would some of those risks and side effects be?
Well, there is a risk of loss of appetite, stomach aches. There's concerns about growth, because if you have a loss of appetite and you're not eating as much, it can affect your growth. Sleep disturbance, tics, which are eye blinking, shoulder shrugging, clearing your throat, are vocal tics, but tics can happen with them. Very rare cardiac problems, so you do need to have a good history about if there's any cardiac or heart problems in the family, if there's any structural heart abnormality, because oops, I was supposed to watch my microphone. There are some risks to the heart if you don't screen for those things. You don't want to put something in, give a medication that could cause some serious adverse effects.
And actually one of the things that you do then when you're prescribing a stimulant medication, especially for a child who's still going through who's still growing, mm-hmm. is you measure their height and weight, mm-hmm. and monitor. And
their blood pressure and their pulse, and yep, it is something that needs to be closely monitored. But when you see a child come in and you hear how much better they're doing, and the anxiety in the family settles down, and the child is now learning and they're enjoying school and their friendships are improved, it's just such a wonderful thing to see. And so it can be a very positive part of the treatment. But in addition to medications, there's also psychosocial treatments too.
Talk a little bit about the psychosocial treatments.
For adults first. I did want to mention something, that there really are three kinds of ADHD that we need to mention. And we've been talking about the the ADHD, the combined, we call it the combined type, with that has the inattention, the hyperactivity, and impulsivity. So that's that type. Then there are kids and adults that just have the inattentive type, and those groups are really very different from each other, and in fact, some ways are sort of mirror images of each other. For example, the hyperactive impulsive kids are exactly that. Hyperactive impulsive, the inattentive kids tend to be maybe more slow tempo, lower motivation, more anxious rather than impulsive. And then there's a group of kids what we call acquired ADHD, that they've gotten it through some means, that, for example, a head injury, or kids who have been treated for cancer or birth injuries or drinking during pregnancy. So those kids can be quite different. But what we try to do with the psychosocial, or we call it behavioral or environmental, is we try to compensate at whatever age for what people can't do that well for themselves. So if it's a high school student, they may be quite capable in a lot of ways academically, but what they lack is organizational skill. So then they need some help in two ways. One, they may need somebody to help organize them a little bit. They need sort of their executive secretary, but then they probably need to learn in a more deliberate way how to be organized. And the same with adults. For adult ADHD, two things I think are really important. Self-awareness, which you find the right place to work, the sort of the right place. You know, you maybe don't want a job where you're sitting still all day long. And then you need to know what your limitations are, and you address those. So, for example, organization. People need to learn to write things down, and they need to get their little electronic notebooks, and they need reminders for themselves, and they need to compensate for themselves.
And my favorite strategy really is the smartphone for my adult clients with,
it's got alarms,
with ADD.
And
it has alarms
and it reminds,
in it.
And, yep, it's like a little external brain.
And they can, there's so many applications that they can use to help them with daily organizations and setup functions. And the difference that I have seen in terms of medication gets them to 75 to 85% better, and that degree of organization. And I really like what you said, Charlie, about making sure that you've got the job that's well suited for you, which we probably all should be doing anyway, but really important for this group of people, because it's going to make a big difference in the success on the job.
Well, we know that people with adult ADHD, there's a higher rate of self-employment because they can run at their own pace and do things in their own way. Also, though, the younger the child, the more you do have to emphasize the behavioral interventions. We always, with very young children, we always combine behavioral with medication. We never treat a 5 or a 6-year-old with just medication. It's always classroom accommodations, making sure the classroom's structured properly, making sure home life is structured properly.
Well, here's a question from Annette in Brookston along the same line. What are some techniques and strategies for getting my kids to focus and do their homework at night once their ADHD meds have worn off? Dr. Saraceno.
Well, I would look at the timing of when the homework is being done. I mean, I think that really is families, you know, it's differing for different families and for different children, but if a child's medication can last through 3 or 4 o'clock, trying to have them come home from school, do their homework first, and then go play, try to have some motivators to completing this, and then you get this. Again, working with a therapist to look at how they can structure the family, how can they set up rewards, withdrawal of privileges based on complying with that behavior plan.
And there might be some instances where you have to take breaks. And these are not kids who are necessarily going to sit down for 2 hours and 2 hours straight and do homework. Where if your child needs a 5-minute break every 20 minutes, and that's the best way for them to do their work, then you need to let them take those breaks, and they need to be maybe able to do something fun, or running around, or burning off some of that energy during that time.
Routine. So you need good study habits and good routines. So you need to have a place that's quiet and distraction-free to study. You need to study the same time every day. And hopefully if you can get it in under the umbrella of the medication, that's even better. I tell parents that and it depends, of course, on the age of the child, but every day you need to sit down and make out a study schedule and go through everything with your child, because now you're teaching them organizational skills. And so you break it into study sessions, length of study sessions that match what they can do, like 20 minutes, little breaks, And one that I find that helps a lot is you figure out, I help the kids say, what do you like the least and what do you like the most? And we always study what we like the most first, which is exactly backwards. Tell them, study the stuff you don't like first and save the subject you like for the last, because that's probably easier to pay attention to it.
And I hope all of you parents are paying attention to that out there, because these are just absolutely good study skills no matter what. Whether your kids have ADHD or not, that's good advice. Do kids grow out of ADHD where they don't need any medication? We have 30 seconds for that answer.
30 seconds?
Yeah.
Not necessarily. I think some may improve. There is good evidence that ADHD does persist into adulthood, which is why we are talking about adult ADHD. And knowing if you have it and learning some skills to deal with it will help you to be more successful as an adult. Is it
Any last short words?
Start with your primary care. Get a good medical evaluation. They can usually refer to a mental health professional if you should need it.
Thanks to both of you for being here tonight. And thanks to all of you for being here tonight. And don't forget to visit us on the web at speakyourmindonline.org, where you can find a schedule of our topics and resource links, and read my blog. A little slow getting that up last week. I'll try to do better this week and that would be more focused. That's the place where I answer more of your questions. You can also email us your questions about next week's show, when we'll be talking about soldiers, veterans, and their families. I'm Dr. Carolyn Phelps. Thanks for watching, and good night.